Health officials across the country are seeing an increase of COVID cases and hospitalizations.
And now concerns about yet another variant. Many of you at home have questions tonight. State epidemiologist Dr. Benjamin Chan joins us live now to answer some of those. Good evening to you, Dr. Chan. Thanks for being here with us.
Good evening. My pleasure. Happy to be here.
Our first question for you, what is the current status of COVID in New Hampshire? Parts of the country are seeing an increase in hospitalizations and deaths. So is that happening here?
Yeah, it's a great question. And as we know that COVID-19 will continue to circulate, and as we know that a lot of the testing that's being done right now is being done through at-home testing, it means that our numbers, the number of new infections we report out, is becoming more and more unreliable. And so for that reason, we're paying more and more attention to what's happening with hospitalizations due to COVID-19 and deaths due to COVID-19. And what I can say is that in New Hampshire, we're holding steady. There's been some ups and some downs since the Omicron surge over the winter around, April, May. The number of hospitalizations due to COVID-19 went up. Those hospitalizations have since come down a little bit and started to plateau. And similar pattern with the number of deaths due to COVID-19. So I think the general message here is that COVID-19 is still out there. There's still risk from COVID-19. We continue to see people hospitalized and dying from COVID-19. But because of vaccines, because of immunity in the population, we're holding steady and keeping those hospitalizations and deaths at a lower level compared to what we've seen at other points during the pandemic.
Now, our next question, we want to talk about the new variants here. How concerned should we be right now with the new variants that are spreading?
Yeah, so we've seen throughout the last 2.5 years that this is a virus that will continue to mutate and undergo genetic changes. And we will continue to see variants emerge and variants of concern. New variants of concern emerge. And, these variants have been identified to be more infectious and more easily spread and more likely to escape or evade someone's immunity or their protection. And so we continue to see that, particularly with the newest variant of concern that is increasing in New Hampshire and nationally, which is the BA.5 variant. So, similar to what's being seen at a national level, this is another variant that's coming our way. It's been shown to be more easily spread, more infectious. And for that reason, there's a move at a national level to try and update our COVID-19 vaccines to better cover this and other emerging variants in the future. And we may potentially see those updated COVID-19 vaccine boosters as early as this fall or end of this year.
Now, our next question is from Martin. He is asking, which variants of COVID-19 do the current home kits test for?
Yeah, so this is something that the Food and Drug Administration is monitoring, or the FDA. And the currently available tests, both laboratory-based PCR tests, as well as the at-home tests or antigen tests, are expected to pick up the new emerging variants. Now, we know that at-home tests or self-tests tend to be less accurate than some of these laboratory-based PCR tests. And so if somebody uses an at-home test, maybe they're very early in the onset of their symptoms. If they test negative, there is a role, and it is the recommendation that people consider testing again, a day or so later with another antigen test. Because what we've seen is that somebody can initially test negative with an antigen test. A day or two later, that antigen test comes back positive. So they will still detect the new variants, but there may be a need for somebody to retest a day or two later.
All right, Dr. Chan, thank you so much. We have much more to get to this half hour. More questions coming up after the break. Thank you for your answers right now. We'll be right back after this.